Assalamu alaikum, I'm Dr. Mariam Atiq, and today we are going to talk about altitude sickness, acute mountain sickness. Yesterday there was an incident in Pakistan in which a cable car broke down and people got stranded and they were hanging in air for more than 12 hours. So what happens? What happens when something like this happens, or what happens when people who are normally living in low areas decide to go hiking or go for mountain climbing? If you ascend to high levels of altitude very quickly, then the body can feel nauseatic and there can be lightheadedness because the body is trying to acclimatize to the low air pressure and the low oxygen pressure. This can make you feel those symptoms. This normally occurs when we climb to a height of more than 6,500 feet above the sea level, but for some people who are not really accustomed, these symptoms can start after 4,200 feet. So as you climb high between 6,500 to 8,000, it is a moderate high altitude. Then between 8,000 to 12,000 to 14,000 feet above sea level is high altitude, and above 18,000 feet it is very high altitude, in which the people may require extra oxygen tanks or masks or everything to remain healthy. For people who are not adjusted and they remain in this low oxygen environment for longer periods of time, especially if they are having heart disease or kidney problem, if they are pregnant, if they are living in the low-lying areas and this is their first experience to go up, or they have had previous history of altitude sickness, then you have to take more care, because blood vessels can start leaking fluid in continuous hypoxic environment, and this fluid then collects around the lungs, causing high altitude pulmonary edema, and it can collect around the brain, causing brain swelling and high altitude cerebral edema. When fluid is around the lungs, then you are going to feel shortness of breath. You will feel a tightness in your chest. You might feel suffocation. You can get cyanose, that is blue discoloration of the fingertips and the skin and the white portion of the eyes because of low oxygen concentration. Then there can be confusion, there can be extreme fatigue, there can be feeling of suffocation, and then there can be persistent cough, bringing out watery white fluid when you cough. Then similarly, if the fluid has collected around the brain, there will be headache, there will be nausea, there will be vomiting, there will be disorientation, there can be confusion, there can be memory loss, there might be hallucinations in which you are imagining things which are not real, there can be psychotic behavior, there can be abnormal behaviors when you are perceiving things, when you do not understand what is real and what is not real, and in more severe cases, due to lack of this or pressure on the brain, of oxygen or pressure on the brain, a person can get into unconscious state, that is coma can occur. In all these situations, you need to get back to lower levels, contact a doctor, get the first aid immediately, and you might be needing tests like X-rays and MRIs and CT scans to see how much is the damage. But this normally occurs when the people are at very high altitudes of above 8,000 feet. But those who are not accustomed can start feeling the symptoms earlier. So you have to be fully prepared. You have to know your basic guidelines. You have to plan your trips if you are going for mountain climbing, if you want to go for hiking, or you are already living in those areas, but if you are sick, then you have to be planned and be ready for it. Always make a plan, check out the weather conditions, then you should have a companion with you, you should have your first aid boxes, torches, extra warm clothes, then eating things with you, then some oxygen cylinders or tanks, masks available with you for emergency cases, and your cell phones should be ready, they should be charged, you should have all the emergency numbers. Now what you have to do yourself, you have to know, you have to change your routine. First of all, you have to stay hydrated. Drink lots and lots of water, because as we ascend higher up, the body loses water and salts more quickly. So the water level has to be maintained. Then eat more calories. Around 70% you have to take carbs, because extra energy is needed at those levels. And carbs, we know, you can get from whole grains, the bread, rice, pasta, all these things. Then you have to take in more potassium. That can be very helpful to keep you awake and alert. The easiest source is bananas, then they can be tomatoes, they can be potatoes, they can be the greens, they can be avocados. All these things will be very good to keep with you. And you have to decrease your alcohol consumption. There should be no smoking at all. You can take precautionary tablets and medicine of advised by your doctor, the acetazolamides. These increase the heart rate, and therefore more oxygen can be taken up by the body, and the body can adjust easily to these low oxygen conditions. This needs to be taken 24 hours prior to the starting of your journey, and for up to 5 days. By that time, the body is going to adjust normally. In 3 to 5 days, the body adjusts, and you can start living easily in the higher altitude areas too. So you have to take care of these things. Other than that, there should be a pattern of climbing. Do not climb very high all at once when the body is not acclimatized. Just climb up to 1000 feet a day, and then take a bit of rest, and then you go up, higher up again. For every 3000 feet of climbing, you should take a 24 hours rest for the body to acclimatize. And then you have to carry your oxygen supplies, you have to carry your mask, you have to carry your inhalers, you may need a respirator if you are going higher up, and you might need steroids in case the cerebral edema is too much, you are having all those confusion states and everything. You need medical help, and at that time you have to get back down and consult the doctor and stay safe. So please take care of these little things, and be prepared all the time, and plan your travels and your hiking way before, so you can enjoy it and stay safe. Thank you, and Assalam.